We want to welcome you in on this December 8th, 2020 to Coronavirus Inside the Arizona Numbers, where we take a closer look at the numbers coming out of the state of Arizona so that you can make the best choices for your life, your family and their health best. We're just here to help guide you through these numbers. We had some very high numbers today, and in the same breath, I can tell you that we've had some really hopeful news out of the UK with the first vaccines being administered overnight for us. The first woman there, Margaret Keenan, getting her shot. A man getting his shot right after. I don't know if you noticed his name today, Garrett. William Shakespeare got his shot. So just some fun to be had in all of this, as well as we report on some really difficult numbers, some really tough stuff today, considering we're in the holiday season and these case numbers are rising, which then always means hospitalizations rise, and ultimately people do not make it through this. So some very troubling news and all of that. But we can highlight the good as well, and the hopeful in that is getting closer to a vaccine, which hopefully will get us closer to everyday life once again. All right, Garrett, let's walk everybody through these numbers here in Arizona. A staggering number of cases today, higher than even you and I thought we would see.
Yeah, I was expecting a pretty high number today. I was thinking about 10,000 again, but we're at a high number. It was 12,314 today. That is obviously a record. This beats last Tuesday's record of 10,000. So basically, what we're looking at right now is Tuesday from last week was people getting in or positive tests coming in that came in from prior to the Thanksgiving holiday, and now we're seeing tests that are coming in from Thanksgiving itself and that weekend afterwards. So people that were at somewhere on Thanksgiving and then possibly stayed through the weekend, left wherever they were on Sunday. And this is where we're seeing those gatherings that we're seeing. That's what this is. So second highest, we've had six since December 1st, 6 records since December 1st, essentially.
Six records broken for case numbers specifically locally.
All 6 of the top case numbers from this entire pandemic, at least reporting wise, have come from the past, from December 1st and beyond. That's what we're looking at right now, as far as just the height of these numbers.
Okay, we're seeing so many people say, well, 12,000. We're seeing that on a Tuesday. Of course, that's weekend reporting. It can be in part, but how do you see those numbers to sort of look maybe like a week to week? We're still increasing.
Correct, we are, and we'll go over that right now. The average number of cases we're seeing. So we'll just go over this again. Oh, sorry, I'm in the wrong. I had the wrong browser open, so let me just go back and apologize. I have like 50 browser tabs open, and I had the wrong window open. So this is the case numbers. And as you can see, this is what we're talking about. This is date of collection. So obviously there's no number here that says 12,000. So this is what we're talking about. These cases that were added today were added within this block of time right here from December 1st, a little bit here on this November 3rd, 26, 27, 28, but mostly from this just November 30th, December 1st, 2nd, and on to today. That's where the majority of these came from. You can see our highest date of infection right now is November 30th at 7645. And our average number of cases that are being reported on any given day is at 5,800. That is the highest that we've ever had today.
So our average number of cases daily reported is over our high peak of single day reporting in July.
Yes, correct. It is. We are at the highest point as far as reporting right now than we ever have been.
Yeah. Okay, so just to remind everybody, I know we have a lot of new names and faces showing up in the comments. So when you take your test, when you take either your saliva test or that nasal test, we're then plugging the date of the test back in on the chart. So when you see 12,000 reported overnight, it doesn't mean those people went in the last 6 to 12 hours and went and got tested. It means that there was a collection date in the last few days, and we're plotting that in so you can see the very truest numbers of where these numbers fall in. And so the last date would be one of the lower ones because it hasn't been plugged in with all of these case numbers just yet. Right. That will backfill.
Let me show you the difference so everyone knows what we're talking about. So I'm going to go to my internal dashboard here. This is the reported curve. So you can see these are the two big lines that we're talking about, this 10,000 report and then this 12,000 report. This is on date reported, and that's why you see some of these spikes and some of these lows because, Tuesdays have always been fairly high. and weekends are fairly low. So that's what this accounts for. And you can see our 2 massive days here. But the reported line here, we're our highest average. I'm going to go past some of these right now and go to the other one, which is the active cases. And this is what we're talking about. So you can see here, our average right here for active cases a day, which only goes back to about November 30th, is at about 4,500. And this light blue line are the cases that were added today. So all of the cases that were added today are right here. And you can see, the majority of them came from the week of November 29th on, which is last week, about basically all of them, 12,000 cases basically added from last week.
Okay, so Garrett, and I want to spend a little more time on the first chart that we always start with from the state health department that's got the numbers here in Arizona. As we mentioned, 12,000 new cases reported in today. 8,000 of those came from Maricopa County alone. What are some of the other counties that are seeing higher numbers? Because as we know, Maricopa is the most populous county in all of this, but we still have about 4,000 other cases there to make up for in the 14 other counties here in Arizona. So who also is showing up with some pretty high numbers right now?
Well, let's go through it right now. So as you just said, 8,000 for Maricopa County. So let's just go basically by population of the county. Pima County has about 1,000 cases that they added today. Pinal County has about 600 cases, which, I mean, it's much less than Pinal, but you remember Pinal County is much smaller than Pima County too. So a lot of cases coming from Pinal County. Notable thing to say about Pinal County is that they do have one of the largest prison complex in Arizona, and I know that a lot of this is a congregate setting, and there has been a lot of cases coming from congregate settings. You go to Coconino County, you can see 168 cases there. Yuma County, 735 cases in Yuma County. Huge numbers for Yuma County. It looks like they're having a pretty significant spike that is, again, over their population per capita rate for the state. It's there. So we're also going to check Santa Cruz here. Santa Cruz, 109. Let's go over to the Navajo Nation really quick and see what their numbers are at. 290 for for County of Navajo, and then Apache County, only 88. Mojave County over here, 382. So as far as these per capita rates in these other counties, they're a little closer. Yuma's per capita rate is extremely high compared to the others. We can see this right here if we go to cases per capita rate per 100, and you can see the this is the 8910 for Yuma. So they are still at the top of the per capita sort of ladder here in Arizona for all of these counties, followed by Apache County, and then followed by Navajo County, or excuse me, followed by Santa Cruz County on the south, my apologies, the smaller county, and then Apache, and then Navajo.
Okay. And our number of tests coming back is incredibly high as well. I'm seeing 20,000 tests reported in overnight. Now, you were saying there were still some probable cases out there that are still waiting with the state to be confirmed and added into the chart?
I have to look at that. That was yesterday.
Have they cleared those? Yeah.
Yeah, or I didn't actually check to see if there was probable cases in the positive test case. But however, it's a good thing you brought that up. We actually have a new testing dashboard to look at.
Yeah.
So let's go over there. So if we go to the laboratory testing, which we've been to a couple times, you can see it has some significant changes that we need to go over here. So I'm going to put this down to diagnostic tests. And this is what these numbers look like. You said 19,000 and 2.4 million tests. But you see right here, it says number of people tested. So what they did is the AZDHS is now giving us not just the number of people tested, the tests per person, but they're also now giving us the number of tests completely. So that's this dashboard. And when we look at this, we can see these numbers are much higher because people are taking we always get this question a lot where people say, oh, well, what about multiple people taking tests, duplicate testing, people taking so many tests? Well, this is what this is. This is those duplicated tests, these negatives that come back for people that do test multiple times. You can see that Arizona actually processed almost 40,000 tests in this 24-hour period of reporting. Rather than that 20,000. So when Ducey and the government does say, oh, we can process 60,000 tests, we are actually much closer to that number than we had thought we were based on this new dashboard. You can see we've processed a total of 4 million tests in Arizona. That is much higher than the 2.4 million that we thought were the number of diagnostic tests that we have processed. So we processed a lot more tests, almost double the number of tests in Arizona than we thought we had.
Yeah, I mean, that's incredible. That part of the chart just added in. Do we know why? Were they just able to upload this information or create this
Yeah, I
dashboard?
think so. This is a pretty complicated process in order to be able to separate the people who test multiple times. There's actually this is a pretty complicated process in the back end. So I think they had a lot of work to do to make sure that this didn't mess with the rest of the dashboard. And that's why it took so long for them to do it. But they were also getting this question a lot. So I think they've always told me, I remember months ago, they said they wanted to roll something like this out. And so it just took them a while to get it out, but they finally did. And as you can see, 4 million tests, 37,732. And in that 20 to 44 age group, 1.7 million people, or 1.7 million tests, excuse me, have been administered. Because this is all, when you talk about this dashboard, it's tests and not people.
So this pull down bar at the top there, it's got all and diagnostic. What else does it have on it, or just the serology test? Okay.
So you can see the serology, the antibody tests, and that's about 456,000, and about 2,000 tests yesterday were serology that were processed.
Yeah, just a fascinating look at a closer look at how these all break down. Even this serology test in the age groups is interesting too.
Yes, let me go to that really quick. Serology test age groups, you can see, and this has been an interesting data point for a while now. You can see nearly no tests are done for antibodies for people less than 20 years old. I think that has a lot to do. I think, Katie, you said that when you tried to get your kids tested, they wouldn't even do the blood test for them. So, and it does appear that that is the case with only 16,000 for this entire pandemic in that age group. But then again, we go to these, you got 160,000 for this age group, which you can imagine this age group is composed of both college students and medical professionals. A lot of them are going to be registered nurses, and other people in healthcare are going to be in this group. Also in this group, 81,000, and then it goes up to 65 years and older, 111,000 tests, and that's going to be the long-term care facilities, where they've been trying to contain anything and make sure that COVID-19 doesn't fully spread into those areas any longer.
Yeah, I guess the 65 and older age group surprised me that many had the serology test. I find that fascinating because I'm like you. I'm thinking it's more people who are in the workforce who are not working from home, who are back at work, who are looking to see if they have any antibodies, if they've ever been sick from this.
Yeah, agreed, and that would definitely be that's reflected in this. However,
Yeah.
like I said, I think you can see with this number that there was a lot of effort to be done in the long-term care facilities to just make sure
To learn more.
Yeah, there were more in that age group, and while it says it's a fairly large age group, 65 years and older, so you would expect that number to be a little higher than these 10-year increments. However, that's very likely where it is in that long-term care facility numbers.
So I'm curious. Obviously, we haven't spent any time on this page. That's why we're
hanging
out a little bit more today. These two charts on the bottom, are they then reflective of each other when you're looking at it from the serology page? Now, if you click down and pull the diagnostic page, does the bar graph then look the same? Are they sort of
these are weekly now. They used to do it daily, but it was getting very difficult to read the daily ones, and so this is a lot better.
Yeah,
easier to read. So but these are weekly, and you can see these are actually done, as you can see, positive diagnostic and serology. So these are already split out. So pushing this bar is not going to do anything. However, it is on the tab, so you can see our percent positive obviously is a bit lower when you're looking at all tests conducted than it would be on, say, if we go to people tested, and you can see this number, for example, is 23%. This last number, it's actually the most recent week we have is 18%. But if we go back to tests conducted, we can see that we're at, what is it? It looks like it is, sorry, it's hard to read some of these sometimes. It is at about 18% too. So it's about the same for that specific week.
Yeah. Okay, so Garrett, I didn't have the question, or I haven't seen the question here in the comments, but I did get the question today. I believe it was on Facebook. Oh yes, and Debbie, we will talk more about what's happening in the UK in just a few minutes. The question came in. So people were taking the number today of 20,000 tests,
Yes.
12,000 being positive, and that percent positive number when they're dividing those together is quite alarming. Is that an accurate way to look at it,
No.
or is there a better way to? Okay,
No.
explain that
No.
to everybody, because they say, "What? It's 60% positive.
No.
What's going on here?" So, can you help them better understand that?
Especially on Tuesdays, you do not want to use that number right now, especially when we're seeing these spikes in updating information from Thanksgiving. Like you said, if you looked at that number today and you just simply divided the case number by the test number, you would get 65%. But obviously what's happening is that the negative tests are coming in and they're being processed, but the epidemiologists that work at AZDHS are processing cases slower. It obviously takes a lot longer to process a case than a negative test, because the negative test is just put in the system and let it go. A case has to be researched and just basically checked for accuracy, and that's when you get this sort of lag, which shows up with this 65%. Now, we don't want to use that number. This is a better number. I do publish it on Twitter, and we use this number at the newsroom. This is basically, if you take the epi curve and you divide yesterday's edition or today's editions against yesterday's with the tests that were also done at the same time frame, with day for day, then this is the number you get. Our positivity rate for the day is actually about 19%. And here's the counties. You can see most of the counties are in the double digits. You have some smaller counties with lower digits, but Graham County with a 30.6, Yuma with a 21, Santa Cruz with a 25.8. Yavapai with a 20. So a lot of double digits here, sort of high double digits. But when you look at Maricopa, and Pima, where most of our population is, of course, you can see those two are both at around 18, 19. And that's what brings us to that 19% positivity, since most of the tests are being done in those urban areas.
That helps to better explain that. I got that question from a few people, so wanted to make sure we had time for it. Let's see. What are the main reasons for this surge? Even though more people are wearing a mask, social distancing is being practiced, and new medications are being approved. So, I guess that sort of remains to be seen. But what we can tell you is we saw a huge spike in testing numbers before Thanksgiving. A lot of people were trying to test their way into safety to get together. That can be debated whether that's a safe move or not. But taking a test, hoping to get a negative test to be able to see friends and family before the Thanksgiving holiday. And then it seems like with a lot of these positives coming in, the concern now is that people then got a message from those friends or family saying you might need to go get tested, or they were experiencing symptoms themselves. So just anecdotally and all that, we're kind of seeing those numbers reflective in that situation there. Sorry.
Yeah, no, I know there's something's going on back there. So it's actually a great question, and definitely something that we can only give some cursory exploratory estimates to. This is something, the question of the masks and why things have gone up, and the question is whether masks, in many ways, the question with masks is not really, it kept things down, is would it have gone up higher without the masks?
Right.
And this is something I'm not going to try to answer right now, because this is something that's going to be studied for the next several years. And I'm going to try to figure this out. So I'm not going to make any estimates on that. But what I can tell you is, if we look at one of the variables that we can look at that might help explain some of this increase, even with the mask mandates and with people being a little bit more conscious about what they're doing, is the mobility index. So, and I have that up here, and we can see that when we look at how this looks, and I need to put this mobility index next to a case graph, and I'm going to try to do that soon so that we can see how they compare, because I've been looking at this for a while, so I know what it looks like. But really, this was the stay-at-home order right here. And then this was the lifting of the stay-at-home order. And you can see that we gained almost to 50% of our mobility in the lifting of that order. And then this is when our summer surge really started to hit, was in this area right here. And you can see as our summer surge ended, so did our mobility go down. And then as mobility started to go, as the case numbers started to rise again, there is a bit of a correlation with the rise in mobility. So we've seen, as our cases, this area, the cases were down a lot right here, but as soon as September, October came around, our cases started to increase again. and that also came with an increase in mobility. Now, obviously, there's this massive drop right here. That is Thanksgiving weekend. There were obviously not a lot of people moving around on Thanksgiving, and it dropped the mobility to almost zero for that one day, and that's what dragged this number down. But you can see it popped up pretty quickly again. And really, one of the things I'm looking at as an analyst is how this graph will end up impacting the numbers. Like, say, for example, over the next several weeks, if this mobility graph continues to go down, or if it goes down dramatically again, like it did right here, does that also come and coincide with a lowering of the case numbers of people testing positive? I don't know yet. It does seem to have some sort of correlation based off the summer numbers, and it's going to take. And this is more of an anomalous drop, so we can't really use this and say, oh, look at this massive drop. Obviously, we're going to have lower case numbers. We need a sustained decline similar to what we see here in order to
affect change,
a case drop. So that's one of the things we're going to be looking at to see if this correlates. But like as we've said, when it comes to the masks and all of the government mandates, I know people can bring up graphs from states that do have mandates and states that don't have mandates. And look, all of these are at least valid to look at, don't get me wrong, but it's something that we're going to have to look at over time, and that people are going to be studying at the university level for quite some time.
For years, for sure. Okay, so I want to get to the hospitalization numbers and talk about how things look, because as for those of you who join us all the time on here, you know that the number that we can show you is that 8% in Maricopa County of the positive cases end up going to the hospital for COVID-19. So when you have a day that has 12,000 cases, simple math here, times it out by 8%, and you're going to see a huge rush of people, if the past holds true, showing up at the hospital again. That's where the concern lies. 1%, just for comparison, end up in the ICU. So how much space do we have left then, Garrett, in some of those hospitalization numbers that are coming out? And I do want to point out there's obviously a difference between a bed and a staffed bed. That's been one of the concerns all along. But how do the numbers look as far as beds go?
So we're in about the same situation we were over the last couple of days. We're sort of going in this 1 to 2% difference today. The ICUs there's a little bit more headroom in the ICUs. It went from 143 to 175. Now, unfortunately, when we talk about ICUs, we have to remind people that, especially with COVID-19, not all of these are people that get better. When we go from 145 to 175, a portion of those are beds that were freed up because people passed away. That's just an unfortunate reality of this COVID-19 situation. But here we are with what we're looking at. We have about 43% of all of our hospital assets are being taken up in ICU by COVID-19 patients. The remaining 47% of the ICU are non-COVID-19 patients. And if we look at inpatient, we can see something very similar. 36% of inpatient beds are COVID-19. 52% are not COVID-19, with headroom of about 12%, 1,000 beds or so left in Arizona for the inpatients. And again, just when you look at these numbers, I just talked to some other, some doctors again, and there is a lot of concern out there about what sort of license capacity they have and the staff capacity they have right now.
I mean, it's incredible to see just that number, 175 ICU beds left. And how many inpatient beds left total, did you say?
We have about 1,000 left. Now, I know that I've had some people that, detract on this data that say, well, what about the flu season and what the hospitals, there have been times where the flu season has caused hospital beds to spike and there'd be little room in the hospital beds during a big flu season. And they're not wrong about that. That is absolutely an accurate statement. The question is not about, with the flu season, that surge usually and typically only lasts for like a week or two, and then the hospitals are sort of back into a normal status. The concern that the doctors have right now is that this is going to be a sustained situation, a surge capacity in which they're going to have to transition to crisis standards of care because it's going to continue for a longer period than, say, a week. That's
right.
The biggest concern they have, and the biggest difference between, say, a flu season and what we're looking at right now.
And as we've talked about on here, it's something that doctors dread, having to make the choices between who receives care and who does not. What about the emergency room visits? Are those still
Sure.
in a better situation?
So the emergency room visits are still in a better situation than they were over the Thanksgiving weekend. I'll go over there right now. You can see we hit not a peak of emergency room visits, but a high for the season so far at 1864 on December 1st. And then we had a precipitous decline. We had a slight increase today. Hard to see because they hide the number or the graph portion of it, but went from 1485 on the 6th to about 1550 today. And so just a slight, an increase. But it's going to be interesting to see if this was a holiday spike or if this is where our numbers are going to end up at. We don't know yet. We just simply don't know. Is it typically a good thing because it's a leading indicator? Yes, it is a good thing. Usually lower emergency room visits does indicate that there's less community spread out there. However, what's we don't know yet is, did the holiday season, did Thanksgiving weekend apply more pressure to this particular metric than it would otherwise just have in a normal setting? So we don't know the answer to that yet. We're going to find that out over the next week or so as they fill in more data here, and we'll be able to sort of determine where this line is going.
So this is the one metric that has not passed by the July numbers at this point.
Well, no, none of them have actually passed by the July numbers. I'll look at that right now. We're getting very close to the July numbers.
Even the ICU at 92%?
Yeah, no, no. The headroom, yes. The headroom itself. COVID-19 numbers have not passed. Right. Have not passed the July numbers yet. The headroom did, yes. I need to clarify that. But here's what our numbers look like with all the hospitalizations, just basically on an index, so they're all on the same page. You can see we're passing 75% for ICU. We've already passed for inpatient. We're almost at about 80% of where we were in July. And then in emergency room visits, we're at about, it looks like about 77% where we were.
Yeah, that chart really helps us see kind of the comparison to July right there. That's your own chart that you put together.
Yeah, that's my own chart, yep.
So how are things reflective here in the United States? We had 192,000 cases reported in the U.S. In the last 24 hours, 1,404 deaths. And the big states for the last 24 hours, I always keep you updated on this as well: California, Michigan, Ohio, Pennsylvania, and Texas. So those are the states to watch right now. California and Texas kind of staying in the top 5 every single day. Obviously, a huge population there as well. So that's something to also factor in. Okay, just a few minutes ago, Carol had asked about, Debbie had asked about the hopeful news out of the UK. There really was some hopeful news, Debbie, overnight. 90-year-old woman in the UK became the first person to get one of Pfizer's doses. It's really considered by so many to be sort of a turning point in this whole pandemic, something so many have waited for. And then, as I mentioned off the top here about the next person who got their shot, named William Shakespeare. So a little bit of fun in all of this, and a few giggles, if you will. And then, of course, because it was reported out of the UK, I know you'll appreciate this, Garrett. They called it a jab. Are you going to get your jab?
That's so British to do something like that.
So I have a British uncle, so it's always fun to tease him about the different ways and the different words that they use. But talking about people going to get their jab. So in all seriousness, though, this first rollout here in the UK is something everybody in the US is going to be watching so closely. We're watching how it's going, what we can learn from the situation, where there are any bottlenecks. Their goal is to, by the end of December, let me say that again, have 4 million shots given out, mostly to those in nursing homes. On the flip side, in Australia, they're partying, they're celebrating, Garrett. There are these videos coming out on the internet of it just feels like you're being transported to another time, because they're like in a crowded concert and they're all partying and screaming because they had a double donut day. They had 0 domestic cases and 0 new deaths. So obviously that is something very much to celebrate, and something sadly that we are still far from, but hopeful news in 2 different areas that we're watching closely. Okay, when I mentioned Carol just a minute ago, I want to get to Carol's question. She had a really good question about comorbidities and where she can find that 65 plus age group. Her question was a little ways back, so I might have to scroll through all the comments, but basically she was asking about the 65 plus age group, where she can find those numbers about comorbidities as well. And I believe the best place for that is probably maybe on America Maricopa County's health
Yeah,
department site. That's really easy to read.
That's the best data we have that's public and easy to look at for comorbidities in Arizona right now. I'll share that really quick. Again, this is the Maricopa County's dashboard. And if you look at this top here and you want to look for comorbidities, you're going to go to risk factors right here. And when this is what we're looking at here. So this comorbidities, chronic medical condition. First, we'll just take this one beat at a time here so that we understand this. We don't look at this chart every single day. This kind of draw a line right here. I actually need to contact Maricopa County Health. So
Could you do that for us, Garrett, in all your spare time?
Yeah, just so everyone knows what they're looking at. So
yeah, because it can be confusing if you I mean, I said that to you back in June. I was like, wait, when I'm looking at this chart, it's not totaling up to 100. Why? So you separate it 4 bars in, have the 2 sections at the bottom, and that'll help make the chart.
These are mutually exclusive. They are not tied to these 4. These are their own category, and then chronic and highest risk are 2 their own separate categories. So you can see. Of the age group, 73% of deaths in Maricopa County have come from the 65 and year older category. 51% of deaths in Maricopa County have come from those who have had a chronic medical condition. But when you add them up, which is the highest risk, which is people over the age of 65, as well as anyone that has at least 1 chronic medical condition, that number goes to 84%. So really 84% of the deaths, 85% of the ICU. Obviously, there's a tie in those numbers right there. And then 56% of hospitalizations. So this is really the absolute, that's why they call this the highest risk. This is where, if you fall in that category, if you get COVID-19, that's a big problem. I mean, your statistics are not as favorable. I know people, like to put out that 99.9% recovery rate thing that people use. But if you're someone who's over the age of 65 and you have a comorbidity, that statistic is not for you at all.
Yeah. And you know what? And those Garrett, those comments really do a disservice and promote ageism and ableism, because we have to remember our community as a whole and not disregard certain groups or age groups or people, in a compromised health situation, and simply the comments that you're seeing when people say, oh, well, just stay home. A lot of these people have caregivers too, and you can't tell all those caregivers to then stay home. We talked about that case out of Washington State weeks ago, that wedding that was held there, and then people went back to work, and one of them going back to work at a long-term care facility, and now they're looking into whether that person caused deaths at that care facility. So it's really, we've talked about this before, but so important to remember ageism and ableism and not contributing to that. So I'm glad you bring up that percentage in those comments.
Yeah, absolutely. So just that's where you can find this data. This is the best place to find it. So that's where you go.
Yeah. So just to recap, I hope Carol's still with us. She had asked a little while ago. I didn't have time to get to her question right off the top, but this is through Maricopa County, and I don't know, Carol, if you're in Maricopa County, but if not, we can try to find that number somewhere else too. But that is a pretty solid number, considering we have 4.4 million here in Maricopa County, to pull that out to the whole state.
You're really going to extrapolate elsewhere. That's just one of those things that when you have that large of a sample population, it's going to be reflected in nearly all of the counties.
Yeah, it's accurate. So. Speaking of now, once again, accurate numbers, let's go to the R0 and the RT Live that we neglected last week just because there was so much noise in the graph. It's evened out just a little bit. The funny
thing about that, of course, is that
today it's going to mess with it.
Well, no, see, that's the thing. So this is how statistics work. So last week, Tuesday was considered an outlier because it by itself was an outlier. But now that there is another day that is the same sort of reporting in the same sort of magnitude as last Tuesday, it's no longer an outlier. So because we are now looking at more of a normal situation, just simply because of today's reporting numbers. So now when we look at the RT number, we no longer have to say, well, that number could have thrown things into chaos because it's an outlier. Well, it's not an outlier anymore. So now we have to consider today's report in this number. That's just the way it works.
And speaking of that, I see Kevin's comment. I want to get to this really quick. She said accurate numbers and then laughing emojis. Kevin, that's because one of the things that we try to do here for you is let you know when numbers cannot be trusted as much because there is noise in the data or there's something else going on. So it's our way to be transparent to you and teach you when some of these numbers can't be relied upon as much. We're going to help you understand that. So it's not about It's not about anything else. We want to show you when something is stable. That's the
Yes,
difference. It doesn't mean
correct.
it's untrue. It just we have to let it stable out.
Yeah, I mean that's the thing with statistics. People forget. Like they just sometimes people just and again, I'm not trying to mock people. So, statistics are easy to take at face value, but you do have to consider sort of the especially when we're talking about a time series of something that's happening over time. You have to
Yes.
consider when things are more stable and when they're not, and that's based on our reporting numbers. Well, today because of last Tuesday, today is now a stable reporting number. Just just the way it works. So now we can look at RRT and just sort of
And it did pull us lower, actually.
it
Well,
is
well,
actually lower. It is lower today, but when we get tomorrow's report in, it probably won't be lower.
yeah.
But it's at 1.09 right now. You can see Thanksgiving is really kind of thrown a lot of places into chaos because I think California was on this side yesterday, and now it's at the highest RT in the state comparisons. So you can see a lot of the states are sort of in chaos as far as their reporting right now, simply because of Thanksgiving. And here we are. We're sort of at the bottom, or excuse me, the top middle right now. And I would expect our number to go back into like the 1.15 category, 1.14, 1.17 tomorrow or the next day. We should be seeing that again as these things are recalculated. And remember, when we look at this, when we talk about this, it's recalculated daily for the entirety of the pandemic. So even though we're talking about this 1.09 tomorrow, this whole curve is going to be recalculated to whatever the data is tomorrow, which could be 1.17, whatever it is. It doesn't matter.
Yeah.
It's always recalculated.
And this one's helpful too because they've added in the shelter in place, starting the reopening, and just kind of helps you understand where the spread was at which point.
Yeah, and this one, and I think there's some accuracy in this line now that's been here for a while, but this one does presume that we crossed the threshold into a growing infection rate in early September. I mean, our numbers were really good in early September, but that's how this thing goes. This is how this thing works. People start moving around a little bit. They're a little more. They're a little less careless. The college students started moving in. And we started to see some rise in numbers, and that's where we are today. And you can see, obviously, there's a lot of noise in this number, but still, it's where it has sort of the growth starting in early September. That's probably correct at this point.
So, Garrett, you talk about the growth, and I know today is not the day that we look at all of those zip codes, but you do watch zip codes very closely to sort of see where some of the hot spots are every day of the week. And what are your, I don't know, top 5, top 3, whatever top number you have of zip codes here right now?
Let me run that. I do know that Yuma County has taken back the top spot. The top spot had been in Phoenix 85009. For quite some time, and when I looked at it today, it looks like so many cases were added in Yuma that that zip code took the top spot. I'm just letting it run really here, and I'll bring up my top 10 here on what is going on.
Yeah. No, that's fine. And as you do, there's an emergency alert that was sent out in California. Many of you I know have friends and family out there probably getting this emergency alert on their phones. It said basically, emergency alert, state of California, new public health stay-at-home order in your area. COVID-19 is spreading rapidly. Stay home except for essential activity. Wear a mask, keep your distance. And then they have a link to a local government site to keep everybody updated on that situation. But that's kind of like the warnings that we would get on our phones here if there was like a major dust storm coming in or a public safety concern in your area. So it's just interesting how they're using cell phones now to communicate the other way to let people know about what's going on in their area. So that's just happening in California.
So these are hard to see. I have to make these bigger. I'll remember to make these bigger next time. I can't zoom in, unfortunately, on this sheet. But our zip codes are 85364 is now the top zip code with about 7,300 cases in total. 85009 is the next one with 7,200. That's our 7,200. Yes, that's our 7,000 club. And then we have another Yuma County zip code right here at 6,300. And then it starts going into the 5,000 range with a lot of Phoenix zip codes and some Tucson zip codes. We go down here to the fastest growing zip codes. You can see the fastest growing zip code is 85706, which I believe is a White Mountain Apache zip code. No, it is a Tucson zip code. I apologize. That is a congregate setting zip code. Whatever's going on down there, that is a prison complex. 85756, which is the next one, would be the next one down, which is also a congregate setting zip code. So there's something going on in the congregate settings today as they're testing through. I think somebody also someone sent me a tip that that was going to be happening. And then again, the next one right there, 85364, that is Yuma. And that is a combination of just an urban area as well as a congregate setting, a prison situation. So I always point out the prisons and the zip codes because I think it's the right thing to do, especially when I know that there's a very large congregate setting, like a prison complex, that is in that zip code. And most of our top zip codes are our largest growing zip codes at any given time. Typically have some sort of correctional facility inside of them. That is, and they'll pop and then they'll stop for a little bit and then they'll pop again. And we're in a situation in which the congregate setting zip codes are popping right now. So they're finding a lot in those settings.
Yeah, Danielle saying anecdotally, it's crazy here in Yuma. I see long lines for testing. And then one of her other comments, she says we had a saliva testing blitz on Saturday. It had been a while since we saw a large testing blitz. Would like to see more and frequent testing here in Yuma. We want to let everybody know too where they can find the very latest testing if you're looking for that. Garrett, you and I talk about this for so long, so many hours every single day that I sometimes forget that people don't know how to go find testing and don't know the options that are out there. There it is, though. Want a COVID-19 test? azhealth.gov/COVID-19 testing. You've done the nasal test.
I have. It was awful.
I have done the saliva tests. I think those are so much easier and simple drive-through. Yours might have been drive-through too, or did you have to go in somewhere?
No, I went to I have an urgent care like within walking distance of my house. So yeah. I was told to go get one by work because of a possible exposure. So
yeah.
I went that night. I went that night essentially and said, okay, let's do it. And it took about an hour all in for everything because there was a wait of people that were waiting to get COVID-19 tests. But the whole process took about 10 minutes, if that. But it's extremely uncomfortable. It's no fun. But if you have to do it, you have to do it. But yeah, if antigen tested, the saliva test, I'm sure.
I know, so much easier. Stephanie writes, I've done both. Neither are horrible.
I disagree.
For the nose swab, stay super still. Stephanie, you must be like my son because when he went, I was so terrified. I was, Mama Bear watching all the videos online. Like, how do you hold your kid down when you do this? And I'm just like, oh my gosh, how am I going to take my 3-year-old in there and keep him still enough? And then he was like, okay, like he was more scared of the facility than he was of the actual test. And then, I know you're not supposed to bribe your kids with food, but I did offer a McDonald's twist cone for that because we are going to get a snack after. As long as he sat still, I think I was more nervous. He could have eaten the cone in one bite.
Randy's saying you will sneeze for sure. I'm like, oh yeah.
Yeah. Okay, so a lot of you have been through this and made it through this. I always crack up. I was telling you before that they added the test in where or the video in on the testing site for ASU. That's the saliva test where they let you watch a video as you're in the parking lot of people slicing lemons and like squeezing limes and to try to get spit to your mouth because it's just kind of hard to do when somebody says, go. And then they also warn Garrett, don't watch this video too much because it will make it harder for you to then you'll be desensitized. So I just love the psychology behind it. It's too fun how they're putting in every effort to make sure that you're able to do this. Oh yeah, look at all you guys' comments. These are great. Hopefully some of you are watching on Facebook as well as not just, I know this replays everywhere else too. So if you get the chance, go read some of the Facebook comments. They're really funny, really good. All right. It's going to do it for us. We're already out of time. With that, we need to wrap things up, let you know where you can find us. Garrett's Twitter account is at Garrett_Archer. And the very latest reporting in the mornings as those numbers come out for you. And my Twitter account at Katie Rammel. If Facebook is your preferred method, Facebook.com/news from Katie is where you can find me. I'm still reading your comments. Cheryl writes, nasal swab, just horrible. Made my eyes water and hurt. Yeah. See, I'm too chicken. I mean, I will if I have to, but I'm just going to go the saliva test if I can. So, all right. That does it for us. And we will be back here with you tomorrow, same place, same time, helping you gain perspective on these numbers that come out of the state of Arizona so that you can make the best choices for your family and your life. In the meantime, stay safe, everybody.